Good morning, guys. It's Saturday morning. Had a lie-in, 6 o'clock. That's a lie-in for me. Had a cup of tea. Caught up with a few emails. There's no rest for the wicked, you know, honestly. Right, Christmas time. I don't celebrate Christmas, but emails are off. Facebook. Ooh, can I resist Facebook? I hope I can resist Facebook. Don't you need some downtime? We lead incredibly busy lives, and it's a really quite peculiar model when you compare it to hunter-gatherer. But let's not go there because that's a long discussion. So, time to reflect. We all need time to reflect. If you reflect too much, you are lost in your own thoughts and you never achieve anything. But no harm of that happening here. Over 500 patients. Some of you are very needy, but that's because of your E2's high. Once we get your E2 controlled and you see the light, you become a pleasure. And you normally apologise, which is quite nice. But it doesn't stop me getting stressed. I think it's important to realise that the stress that we incur every day isn't necessarily a particularly healthy stress, because it should be a physical and psychological stress, and ordinarily in this modern civilized world it's a psychological stress. And that psychological stress is quite peculiar, isn't it? You know, as a species we worry about money, because again we're the only species on the planet that has to pay to be here. We have to keep up with the Joneses. We have to look pretty on social media. It's all image. We've recently changed the thumbnail on the on these video logs because it was we got some wicked ones. I love them because I couldn't care less. But Lydia said perhaps it's time to change them, so we've got a more corporate, because we're a corporate business. Fuck that. We're a we're a medical clinic, so we've changed it to a nice logo with nature in the background, because as you guys know, I'm fascinated by nature, and I believe our health is compromised as a result of us being so far removed from nature. So, with the release of the Star Wars film, let's call this A New Hope. Because 4, 5 and 6 were decent films, the rest have been absolute garbage. So I don't hold out much hope for this one. Anyway, I'm not going to go there. So, hormone replacement therapy, testosterone replacement therapy. I think we need a new approach. Because when guys have low testosterone, that is all they focus on. It's reassuring that they take it so seriously, because they've often been through some real horrible struggles, not only with the negative symptoms associated with low testosterone, but they haven't found help. They've been offered antidepressants, they've been offered Viagra, they've been turned away with low levels, being told they're normal, so reference ranges are lowering, and endocrinologists are saying, well, you are now normal, even though a year ago you would be abnormal and a candidate for treatment. So what an absurdity that is. Scary stuff. So when you find a cause for your horrible symptoms, it's actually wonderful, because then you go, found it. So lots of guys do not actually have a defined organic cause. Often it's the result of past naughtiness, steroids, recreational drugs, alcohol, opiates, traumatic brain injury, all the things that we've spoken about before. Or it could just be our poisonous environment, BPAs, etc. But we've spoken about that before, so I'm not going to bang on about that. So it's great to actually find a reason for why you are feeling so low. So everybody places all of their eggs in one basket and thinks it's all about my testosterone levels. We found the cause, let's focus on the testosterone levels. Now 100% you want to optimize your male androgen levels. And that means have a nice ratio of testosterone to estrogen to dihydrotestosterone. Absolute numbers are not actually as important as the ratio, in my opinion. Why? Because actually, low testosterone is a natural part of aging. What's supposed to happen as you get older? Your testosterone levels are supposed to drop. But what's supposed to drop in equal measures is your estrogen and your dihydrotestosterone. Now, I'm pretty convinced that the disproportionate amount of estrogen compared to free testosterone is the reason for an increase in anxiety. It's not all psychosocial nonsense. It is part of it, obviously. It's a big part of it, but I mean, it's not the whole part of it. So I do think estrogen's a part to play, has a part to play. Prostate cancer, the more progressive oncologists are understanding that actually it's excess estrogen. Gynecomastia, estrogen causes breast tissue development, but is it the absolute estrogen number or is it the ratio? It's the ratio. So that's why young boys develop gynecomastia. So they have a genetic predisposition to it, but the expression of that gene causes an elevated estrogen compared to free testosterone and DHT. So estrogen causes breast tissue development in females. It also causes breast tissue development in males. So gynecomastia, it's actually because of the ratio, not the absolute numbers. Hence the reason why children get gynecomastia. And men on TRT can get gynecomastia, mentioning no names. Give me strength. So yeah, the ratios are incredibly important. So you wouldn't expect cancer to develop in somebody just because they're getting older. So we have age as a risk factor for cancer. Now, obviously it's multifactorial, free radicals, etc., lack of growth hormone, but I'm sure that actually it's the ratio or the discrepancy that causes the issues, because you're supposed to age gracefully, yeah, disgracefully more like. Let's hope so, Christ. I want to age disgracefully, live a full, healthy life. But it's burn out and fade away. So I think it's important to have a logical approach to this and take everything into context. I think that's one of the things that a doctor can normally do. I say normally, hopefully I do it quite well, is I can contextualize the information that I'm given, whether that be biology, data, and experience. Because the research into TRT is pretty poor. So you have to extrapolate hypotheses from other disciplines. So there are no interventional studies demonstrating TRT. Yeah, but estradiol is estradiol. Testosterone is testosterone. We know that excess. So yeah, give me strength. So a new approach to TRT. We should be considering TRT as hormone replacement therapy. So exogenous testosterone suppresses the pituitary, So you do not send luteinizing hormone and follicle stimulating hormone down to the testicles. So giving testosterone on its own, testosterone monotherapy, from a physiological perspective, is a bit simplistic, because you're ignoring the fact that there are other hormones in your body. Well, I've got the diagnosis of testosterone deficiency, so I'm going to be like Ron Seal. I'm going to do what it says on the tin and replace the testosterone. But that's short-sighted. So what you should be doing is to looking to do no harm and to optimize all of the physiological parameters within the body for long-term physical and psychological health. That shouldn't seem a controversial thing to do. Well, I've got testosterone deficiency, so I need to replace the testosterone. That's all I need to replace. So you need an understanding of biology. You need an understanding, just an understanding, quite frankly. So what we should be doing is using HCG to maintain function of both the testes, recognizing that LH has an effect on the brain, and we should be supplementing with testosterone. That's the reason why my guys need so low numbers or low doses of testosterone. So I've got some guys in their 20s, they only need about 40 milligrams of testosterone a week, divided up into daily doses. And it's because the HCG is mimicking LH, and the testicles are then producing intratesticular production, which then allows all the natural physiological processes to occur as they should do. We've spoken about this before. It's slightly complicated by the fact that LH is released in a pulsatile manner, and HCG is a constant stimulation of the testicles. But it's the best that we've got with. So having an LH analog would not be suitable, because obviously you'd have to inject that multiple times. So it's what we can work with. The slight issue that we have with HCG is the estrogen. Again, presumably because of that fact that it's not a pulsatile, it's constant. So within the testicles, you have conversion of testosterone to estrogen, which helps facilitate spermatogenesis through the aromatase enzyme. So it's slightly abnormal, but it's what we can work with. So can we use HCG monotherapy? Well, the answer to that is it's difficult because of that titration process and the hypothesis that there's downregulation with extended use. But what we should be doing is trying to maintain function. I'm rather uncomfortable with letting my testicles atrophy. I do not want to be part of the tiny testicle crew. So I would like to maintain function and supplement with testosterone to optimize my male androgen levels to within normal physiological parameters. So that's reasonably simple. It's not simple. It can be quite tricky. Testosterone monotherapy is a lot easier because you don't have that. You're less likely to have that issue with estrogen. But from a physiological perspective, hormone replacement therapy makes a lot more sense, in my professional opinion. So, simples. Dial you in. But I don't feel happy. I'm still sad. My libido's not good. Well, it's because not everything's testosterone. So then you have put all your eggs in one basket. It must be the testosterone. I must increase the dose. And then you can obviously feel better, because testosterone helps the expression of estrogen within the brain, and hence you have a dopamine release, which is the pleasure hormone, and then you should use that dopamine. So there was a study I posted on the group last night actually about it was mice. So I mean, hopefully we can extrapolate some useful information from mice. But yeah, they highlighted the fact that there was an increase in activity with testosterone because of stimulation of the dopamine receptors, causing dopamine release. Mice aren't quite as complicated as human beings. Be more mice, be more mouse. So yeah, so you can go, whack up the dose, keep whacking up the dose, and then you can have lots of dopamine, and then what are you going to do with your dopamine? So exercise. We get that question quite a lot actually. Should I exercise on testosterone replacement therapy? I'll tell you what to do, but the answer is yes, you should. If you look at us as human beings, what are we? Hunter-gatherer, tall, slender skeletons designed for endurance. So all you bodybuilders, you're not really going with your design, but we all want to be big, buff and bitching, me included. But I want to be athletic now. I don't want to be big. I want to be athletic. I want to have form and function. Gone are the days where I'm obsessed by my biceps. I was never obsessed by my biceps. I'm not a bicep boy. So I think it's, exercise 100%. Should you exercise? Yeah, but I'm not going to tell you how to exercise because it's horses for courses. Depends on your physiology, depends on your muscle type, depends on your metabolism, what's going to be suited for you. But then you also have to appreciate the importance of nutrition. We're going to do a debunk of the debunk of the debunk of the debunk. Again, lots of opinion, lots of mixed opinion, and again, bias is involved. People compare a vegan plant-based diet to a typical American diet, which is full of processed crap. So in my opinion, and I'm not going to say professional because I'm not a professional in nutrition, but I would say a plant-based diet with grass-fed meat and fish is probably the way to go. Intermittent fasting, 100% love it. 16-8, love it. Wake up. Primary drive should be what? Find food, find a mate, have some. But what happens when you eat? You start your digestive system. That's parasympathetic. That's rest and relaxation. Do I want to rest and relax at 8 o'clock? Well, on a Saturday I do. But not during the week. So I feel an awful lot more alert from using this 16-8. So I start eating about 12 o'clock, but it's normally about 1 o'clock and finish about 8. I tried the one meal a day, but as nice as it was to sit there on the couch looking like I was 9 months pregnant, it didn't actually do that much benefit for my energy levels. So I've gone back to 16-8. Booze, the evil of booze. I'm prone to a nice gin. Love it, but it spikes my E2. So risk reward. Everything's booze, isn't it? All of our social engagements are booze. Booze is surrounded or enabled, whatever. So yeah, risk reward. So I think as long as you can make an informed choice, then we're all adults. Do what you like. So I'm not here to preach, just here to offer my opinion. You may disagree with me. Couldn't care less, quite frankly, if you disagree with me. I have NHS endocrinologists who disagree with me, and I know 100% that I'm doing best by my patients, and my patients know that I'm doing best by them. because we have a long time to talk. We talk about the rationalization for why we do what we do, and there's an acceptance. Because ultimately, when you get dialed in and you understand that it's not simply about testosterone levels, you appreciate that, yeah, this journey is all about hard work, and all that hard work has to be done by yourself. I can optimize your male androgen levels, but I can't really stop you making bad choices. I won't want to stop you making bad choices. Bad choices are fun. But you have to do it with eyes wide open. And I think that's the problem. There's a lot of misinformation, and there's a lot of garbage on the internet. So I think, it's difficult to know where to look and who to trust. We're overstimulated. It's a society full of people trying to climb over themselves to get to the top. I don't really know why that is. It's probably the machine is so distorted. It's quite disgusting, really. But it is what it is. So you can't escape the game. You have to play the game. But do it with eyes wide open. See what makes sense. What's common sense. What seems logical. What seems methodical. If it seems too good to be true, it's often too good to be true. So, what else? Lifestyle. Stress. You need to address stress. Cortisol. You want cortisol when you're in the days. It helps with your immune system. It helps deal with inflammation. It's just the fact that obviously we have an abnormal response to stress, stroke cortisol, because we live in a really peculiar world where our stress is caused by garbage. It's disturbing, isn't it? Sleep, a chance to dream. Sleep is incredibly important. It's when your anabolic processes predominate. I don't need to because I'm on TRT. Yeah, you still need to. It's rest, recover, grow. And it's also a time when you process and you assimilate, contextualize all the ISs. Why do babies sleep so much? They're making, not only they grow, they're actually making sense of their environment. Sleep on it. That's a phrase you often hear. And there's actually logic behind that. Sleep on it. And somehow, some way, your brain has worked out the solution to the question, what is life all about? No. Hopefully it allows you to have a new perspective. Be fascinating to know what actually happens in the brain and how those processes occur and what are the mechanisms. It'd be wonderful, but wow. There are some mysteries that perhaps we're not supposed to gain knowledge on. What else? There's lots of lifestyle stuff. But I think really the approach that we should be adopting when it comes to testosterone replacement therapy is seeing it as hormone replacement therapy, so HCG and topping up with testosterone, understanding the importance of nutrition, lifestyle and exercise, and finally, challenging yourself. Earning that dopamine reward. Don't buy it, earn it.